Welcome back, viewer. We are discussing trauma, and I'm sure there are so many people in the population, over 80%, who have undergone trauma. There is that event in your life which doesn't give you good times when you remember it. Could you be undergoing trauma? Maybe or no. We are here to educate you. But now after that, something has to be done. Ellen is going to take us through on some of the measures that they take to take care of such an experience. Ellen, welcome.
Thank you, Lucy. Well, for us as professionals, I would say the first step is we have to psychoeducate someone regarding what they are going through. Because like my co-guest said, there are those people who don't even know that they were traumatized. They just don't understand what is happening to their mind, to their emotions. So the first thing we do is psychoeducate them of the possible symptoms of how to tackle it. Like they need to know what is this that is happening to them. And then we have several psychotherapy techniques that we use. And one of them is basically trauma-focused cognitive behavior therapy. That has proved a lot of success because it focuses on the restructuring part of the brain, whereby we try to change the thoughts attached to the traumatic event. Yeah, so we'll help them process the traumatic event in a positive way. Especially to alleviate, especially if it's a situation of rape, we will help the client to alleviate thoughts regarding self-blame. You know, they should be able to understand what happened to them was not their fault. Yeah, in as much as they were in an unsafe place, probably at the wrong time, it is not their fault for someone to take advantage of them. So trauma-focused CBT helps a lot, and we also bring on board the support system, the caregivers, so that we also psychoeducate them on the support that they need to offer our client during the process of recovery. Yeah, and maybe lastly, I can talk about stress management. That is also a very key technique because they are supposed to know how to manage stress. Because now when you see you're already traumatized and then stress has come to you, they worsen the situation, they worsen the ability to cope. So we equip them with techniques that will help them be able to manage stress as they are also trying to recover from the trauma.
Additionally, when a person who have been traumatized come to you, like, there is some exploration also we do regarding the event, how it occurred, and the meaning that they've been making. You want to explore on the feelings that they've been having all along. You want to explore on the thoughts, the thought contact. You want to normalize, to tell them it's okay to be feeling like that. Because most of the time, they don't want to express themselves because it's like people are not understanding me. So by normalizing is like letting them know, whatever you are experiencing is okay to experience such a thing. And actually to leave a huge chunk of the stresses that they've been having. You know, the emotions, the feelings that one is feeling, you also interpret the kind of behaviors that they are having, the thoughts they are having about the event. So you also want to explore on the thoughts that they are having about the events, so that you may know, are they irrational? Is there something that needs to be corrected? Or what I had called earlier, restructuring. Because again, the meaning that they are making, or they've been making all along, is the one that makes them live in that state of being traumatized. So again also, there is a lot of psychoeducation helping them to make meaning of why they are going through what they are going. Letting them know it is not the normal way, so they can also be ready to work towards recovery. You know, once they have understood. And then you help them with the modalities of how they are going to process, you know, to go through the journey. And there are many interventions when it comes to that. Even if they are having, could be they are re-experiencing the situations. We call it grounding, like telling them, no, now you are not in that state. you are not in that situation. It is not happening again. You know, that kind of reassurance. It helps minimizing on what they have put in their mind that make them become hyper vigilant. Okay, there is this thing we call narration of the event, that of course it's neither there or there. There are those who support that clients should narrate whatever audio they have gone through, and there are those who feel that it exposes the client to more trauma. Okay, while it is neither there or there, personally I've experienced a lot of help for those people who are able to narrate about their story.
Yes.
Because again, when they hide it in their minds, it keeps on popping, like relieving the situation. Yeah, because they have not been allowed to say, they are not talking about it.
Yes.
Yeah, it will even come in form of nightmares. But when they talk about it over and over again, they minimize the scope of, you know, of the distress that they had experienced with the issue. So that narration of the event, personally in my practice, I have seen it work. But I have to say, yeah, there is a debate around it. There are those who say, yeah, it causes more trauma. Yeah, there are those who may feel, why have I been taken back to where I was? You have made me. But they have the thoughts already. They have the feelings already. So there are those who will benefit a lot when they talk about it. Yeah.
Jen, in your introduction, you said you're working in trauma center.
Yeah.
Apart from psychotherapy, what else do you do to these people?
There is what we call psychological first aid. Psychological first aid.
Yes.
When clients come and they are traumatized, of course, I start off with them having physical trauma. They have been injured. They have injuries. They have physical injuries that are also psychologically affecting them. So when I start off with them, I just ask them very simple questions to help them cope. How are you feeling about this event? Yeah, being able to share how they are feeling. They feel relieved. They become relieved. Now, whatever is pent in them, if it's horror, if it's fear, whatever they are feeling, are they feeling like they're gonna die? Okay. When they bring those, are they feeling angry? Are they feeling like blaming somebody over the event? Are they blaming themselves? Okay. Those things are usually very key to bring out from my clients, actually. And they are helped so much even in coping with the healing process. I have to say, when a physically traumatized person is not attended to psychologically, and they are having these negative emotions in them, they could be emotions, they could be those that they are having about the event. All those things around them, they are negative issues. They project a lot of negative energy. And negative energy usually drains their strength, even their ability to heal. Like, you know, from the observations that we've been able to make. So helping them to relieve them of the negative emotions, the negative thoughts that they could be having. The other thing in what I call that psychological first aid, you want to know whether they want to be supported in anything. Is there help that they want? Do they want to talk to somebody? Were they on any medication that they would want to be helped with? Do they want to say something to their relatives? Do they have any unfinished business they feel like they want to address around that time? Because again, if they don't do it, they don't get contact, get joined, kushikanishwa, for lack of the better word that I'm trying to look for, kushikanishwa with their support system, they remain fearful. they remain fearful. They feel like everything is not going on well. When they are joined with their support system, their relatives, it helps them a lot to cope with the event that they are going through. Those are some of the things. And if, okay, they could be lacking something.
Yes.
It could be lacking something. Those are the basics of the psychological first aid, attending to what they are experiencing at that point.
Now, this client that has come to you, Jane, is not only dealing with him or herself in a vacuum.
Yes, yes.
So, what care do you give to the people around, the systems, as you were saying them, around the injured person, Ellen?
When we talk of the systems, I will talk of the relatives, the secondary people now to this client. We give them support. And one of the support personally I give is psychological debriefing. They need to be debriefed of what happened as well. Because you find that if we just focus on the client, we tend to neglect the secondary, the secondary people. It becomes really not, it's a bit counterproductive. So the best care is to just debrief them, let them know how they are feeling about their person, this person who's close to them, who is going through the trauma. This will also help them in their way of coping. And also you can encourage them to be supportive to each other and to also the client. Because sometimes there are those who will want to take the burden alone. But we encourage them to seek support from others. If you have another relative who can even come to see the client, for example, where Jane works, let them come today, rest today, like they also need support as well. Yeah, so that's basically what we do to assist the other people who are attached to this client.
Debrief is the word you've used.
Yeah.
Remember their code of ethics that surround you as a counselor. How do you handle debriefing and again not affecting your ethics, because these are laws. They can change to be something else. How do you do it as a counselor now?
Okay. When we talk of debriefing, this is where we just want to relieve them of the pressure at that moment. Like you just let them talk about what they are feeling. You just offer that immediate support. It's not so detailed. It's usually discussing about the event and the possible coping strategies that they can use during that moment. Yeah, so ethically that is fine because you're not imposing anything. Yeah, so you're just offering them that listening here at that moment and the possible ways they can be able to cope. Yeah.
Okay, there is this issue of confidentiality. And when I'm talking of confidentiality, it goes along with a lot with privacy. And this person, for example, is being traumatized by, she talked of complicated trauma. Okay. And the person is breaking the laws of this country by doing whatever that person, for example, at workplace, you might find that it is a boss. This lady or this man needs the job. But now as a counselor, you are here. How do you handle such matters, Jane?
Issues of privacy. Of course, that is usually key to the practice of counseling or any health services. You have to assure, although in some areas, of course, it is limited. Yeah, there are those things that you can keep between you and your client. And there are those things that you have to collaborate with the others for the sake of the same client. And when it comes to that, yes, you have to talk issues. You have to discuss. Okay, you have to discuss. If somebody is traumatizing a person, they cannot be told that this thing shall not be escalated to the levels where that person may need help, because it will be one way of helping them to cope with whatever they are going through. Like when we are talking of complicated trauma, it involves very significant persons in that person's life. But then it gets to a place you cannot leave them to break down. You cannot leave them to die in whatever they experience it, because there is somebody that you want to cover up. Of course, even as you escalate, it's not that you want to expose that person, but you are exposing a wrong that needs to be dealt with. What if it's a domestic violence? Do we leave this person to continue being traumatized in such a way because you don't want to expose the other person? There are laws of the land that guides against that.
Yeah.
And they have to be applied. And there are some of the ways that help the clients cope with the issues that they are going through, that they are so distressing, and they are unable to, to cope with them. Yeah, so the area of confidentiality, yes, is guarded. There is that time that you have to talk about it. You may be handling a client who is suicidal. Yeah, a suicidal person cannot handle it on their own. It needs to liaise with many people. Yeah, the significant persons in that person's life. This is a person who needs a lot of support. So, but even as you go out there escalating the issue to other areas, you still collaborate. You talk it over with the patient,
Yes.
or the client, and you tell them what is said that you need to share with the others and why you need to do that. Yeah, of course, with their consent, they do understand.
Yeah.
Yeah.
There is this certain generation which is usually forgotten in trauma, in even in many healthcare settings, the children.
Yeah.
Are children traumatized? And how do we deal with them? Suppose their trauma has not been taken care of. What could happen? Ellen?
Yeah, the issue of children is quite a big concern, because especially these underage ones where they are not able to express themselves. But what we can do is speak out. I would say to everyone out there, if there's a child you suspect is being, for example, molested, is being physically assaulted, just speak out, seek help on their behalf, because they might not be able to even talk about it. Children will usually express trauma in unique ways.
Yes.
Irritability, repetitive play. For example, when they remember what happened, they may just engage in a play that is quite repetitive, but they might not speak about it. So as a caregiver or a friend or a neighbor, if you notice something about the kid, you can talk to them. You can try to just talk to them and see if they'll warm up to you. But if they don't, there are so many centers out here. We are here. You can always reach out to us. We have the Children Welfare Society of Kenya. They can be rescued.
Yes.
And we have social workers as well, who will even look for a place where they can be placed, because we try to save them from trauma. So basically, it's just us being gatekeepers of our kids. If you notice the kid is behaving in a suspicious way, just seek help on their behalf. Even the police stations, they come in handy. You just go and say, I'm suspecting this child is going through this and that, and they will link you to the right places. Yeah, because children get traumatized.
Yes.
Yeah, we have seen trauma in kids.
Who is usually the spokesman of children? Because sometimes you talked somewhere in our discussion on intimate partners who are the cause of the trauma to these children. We've seen children with scars, and if you follow, it's the mother, it's the father. Children who have been raped, children who have been denied education. And these are the same people we expect to speak for them. Yes, Jane.
Yeah, that is the complicated part of the event about the children, that whoever is supposed to take care of them is still the very persons who are traumatizing them. And that is why my co-guest is talking about if one happens to see this. Because there are things that are done under people's roofs, and they are not out there, but you can encounter that child in one way or the other. Could be in the church, could be in the school. There are some behaviors. Those children may exhibit that may indicate this child is going through a certain trauma. Could be they're in the school, they are not concentrating. They've been doing well in their schoolwork. All of a sudden, they have stopped. They are not able to eat. They are carrying their food and they are not able, they are not eating
Yes.
their food. They look withdrawn. That is in the school setting. At home, could be they have started even retrogressing. They have retrogressive behavior, like starting to use pursuing in bed. That is something that they were not doing before. Okay, always complaining. Could be they have headaches, they have stomach aches, right? You know, when one is able to see this, it is good to report. And here it is good for the parents to know whatever they do in their setting, it is affecting those children. You know, there are things that the adults do and they think like, this one doesn't know what is going on. But they are picking. They are picking through their eyes. They are seeing. They are hearing. They are tasting. They are observing, you see. And those are the things that end up bringing trauma into their lives. And you know, the children also, they don't understand themselves. That is the unfortunate bit, that they are not understanding why they are behaving the way they are behaving. And it becomes so unfortunate because when the child starts acting out the trauma, actually it is met with a lot of severity, more beating, more abuse. So it adds on the original trauma.
Ellen, as we come to the end of the show, kindly tell us when and where to refer as you give your parting shot, face your camera, tell us where we can find you.
Okay. Yeah, when you notice someone who has trauma or trauma, symptoms, or you yourself, you're going through trauma, you can always look for any counseling center near you. At least right now, we have really tried to have counseling centers, countrywide. Even when you go online, you can find online services. Just Google counseling centers in Kenya, counseling services in Kenya. So you can always contact any that is near you and you will get help. And as for children, yeah, I've said police stations, we have the children department, children offices. Just go there and rescue that child. And for those parents who are, who are projecting onto their kids, it's usually the traumatized. They have been traumatized in the past as well. Seek help. Seek help and you'll be helped without any judgment. So my parting shot is there's help in trauma. There's no definitive cure, but you can be able to live a productive life amidst the trauma that you're going through. You can reach me through 0720 520 692. 0720 520 692. Thank you.
Thank you so much, Ellen. It was a pleasure having you in the show. Ruth, Jane, kindly look at your camera. Give us your parting shot.
Yeah, it was good having this forum to talk about trauma because many people are living with trauma out there, and could be you even don't know where to get help. We've been talking nowadays of counselors. Counselors, they don't just do talking work. They are trained to handle such issues like psychological trauma. And if you are aware of any near your place, in hospitals you can get them, it is good to reach out. Because trauma, psychological trauma can really disorganize one's life. And you keep on, taken out on other people, causing more trauma. As we are always saying that hurting people hurt others. You don't have to live with that. There is help out there. And in case you would want to reach out to me, you can reach out to me through this cell phone number 0721 44 0084. 0721 44 0084. Thank you for listening.
Thank you so much, our guests. We are looking forward to having you in the future. This is GBS TV Africa. You are watching Health Talk Show. We were discussing about trauma. Everyone has undergone trauma. The question is it making your life uncomfortable? Is it making your life miserable? It is the time to speak up. It doesn't matter what is exposing you to trauma. Speak up. Bye-bye.